Morning at NTV, we are live from Kampala's Serena Conference Center. I'm Andrew Chamagedo. Now, to have the conversation about this entire COVID-19, we want to go a little more international. The Minister of Health has warned that community transmitted cases are bound to increase following the positive infections detected by the Rapid Survey Response Team. And this has seen Uganda's COVID-19 cases rise at unprecedented speed. Rising worries that community transmissions may become our latest challenge. To speak to us about these and the fight against COVID-19, we have Dr. Lisa J. Nelson, the country director of the U.S. Centers for Disease Control and Prevention in Uganda. It's an honor to have you, Dr. Lisa.
Thank you, Andrew. Pleasure.
For starters, try to take us through your work in Uganda as CDC.
Sure. CDC has been working in Uganda since at least 1991, doing public health capacity training with the Makerere School of Public Health. We've certainly increased our investment and our presence with several large initiatives related to HIV through PEPFAR, malaria, tuberculosis, and more recently global health security. And I think as a public health agency of the United States government, we work closely with Ministry of Health, with WHO, working on laboratory strengthening, public health workforce, data systems, and service delivery.
Wow. The recent cases that have been coming in the country, we have seen it has entirely been about the borders, our borders. The very first case was from Entebbe Airport, and the subsequent ones we have registered, it seems to be coming from our poorest border points. Should we be worried about the community exposures to all these and the community transmission? How best can we engage them in time?
Sure. So I think we're fortunate that Uganda acted quickly. They recognized that people coming from abroad were high risk. They worked fairly quickly to have self-quarantine followed by institutional quarantine followed by closure of the border. But nevertheless, there were people who came in who subsequently developed symptoms, etc. I think more recently, as you know, and as you've mentioned, the border points, Uganda as a landlocked country depends on certain transport from neighboring countries. We've seen high case counts in many of the neighboring countries, and we've begun screening at those border points. But as you rightly point out, COVID-19, number one, is something that is readily transmitted. We also know that people who have minimal symptoms or even no symptoms can potentially be infectious, which means it's very difficult to be certain that there's no community transmission. And I think that was the impetus for this rapid survey that's been undertaken to really find out, are we missing any cases in the community? And indeed, we are finding a few cases in the community through the survey.
Well, that said, there was a story we had that was from Masindi where a local police officer turned out to be positive with COVID-19. Let's take a look at that story and we can continue the conversation.
Thank you.
The first community transmission case in the country, detected in Masindi district on the 2nd of this month, has prompted the Ministry of Health to visit the district to establish the level of preparedness there.
We still have pockets of sources of infection at the borders with the truck drivers. So just one case is a potential danger.
The two ministers of health, Dr. Jane Ruth Aceng and her counterpart Robina Nabanja, along with the World Health Organization representative in Uganda, visited areas of isolation, quarantine and the referral hospital.
Doesn't mean you are sick. It means you are under observation. If you pass your 14 days and we take a sample and you're negative, you are released into the community. We want to understand how we can support the district to ensure that we clean Masindi very quickly.
Dr. Cheng says they have built capacity amongst all regional referral hospitals to handle COVID-19.
We want all our regional referral hospitals to be able to treat cases, so that when you have cases here, you have a place where you're going to treat. The districts carry on the surveillance and they feed into the entire process.
Permanent Secretary at the Ministry, Dr. Diana Atwine, says the mobile labs donated by the East African community are yet to be utilized.
The mobile labs came, but the equipment, the machines are the ones that had not come. But the good thing is that we have many machines of that nature in the country. That's why now we are mobilizing them from wherever they are We put them in some of those cars and we start testing.
Uganda now has 3 confirmed community cases so far.
So you've seen that. From your assessment, are we prepared for this? And did the lockdown in one or the other buy us enough time to engage it in time?
Sure. So I think COVID-19 as a global pandemic is really unprecedented. So it's been hard for any country in the world to be completely prepared. As I mentioned, Uganda acted quickly, and I think that's a credit to the government, to the Ministry of Health, and to the partners on the ground to act quickly at the borders, at the airport. But we are seeing a few cases of community transmission, and we're not out of the woods. I think the extension of the lockdown, the lockdown to begin with, has allowed the country to put in place many more preparation measures. So management of cases, proper isolation, better community detection systems, laboratory strengthening. And indeed, the extension of the lockdown will allow us to be even more prepared as and when Uganda begins to lift those lockdown measures.
Many experts have been very undecided when it gets to lockdowns. Do you think that the lockdowns, is it a better preventive measure to engage COVID-19 in real time, or what is your overall assessment of the lockdowns?
Sure, and again, we're really in an unprecedented time. We know that the COVID-19 outbreak is having a tremendous economic impact around the world. We also know that the lockdown measures in many countries, including Uganda, are also having an economic impact. As a public health professional, though, I will say I think our best hope in the absence of a vaccine and in an absence of a treatment that would reduce transmission is to buy us some time to practice social distancing, to practice things that we know will prevent transmission, such as hand washing, etc. And so I do think that the lockdown measures have been important for Uganda.
Okay. Well, let's talk balance now. You advise government, you sit in meetings with experts. What do you say to them about the economic cost of preventing COVID-19, if I should say? Because I know the economic argument always comes in every time medics make a case for a lockdown. What kind of conversations do you have about that with regards to economic lockdowns?
So again, I'm not an economist.
Yes.
I'm a public health professional. I will say that the School of Public Health, together with Ministry of Health and partners, have been doing modeling estimates. Right now, we have 100 confirmed cases, but we could easily have 100,000 or more confirmed cases. And that's based on looking at how infectious this disease is, the fact that it can be transmitted even when people do not have symptoms, and the fact that it's worldwide. And so again, I think we're not out of the woods. I think the economic costs of not putting in place these measures would be far higher. It's hard to predict, nobody has a crystal ball, but I think that at least to date, the measures that a country like Uganda has taken have had an impact. And I think people have talked a lot about flattening the curve. And I think we do see, compared to its neighbors, indeed, Uganda has had some success in reducing the number of new cases and buying ourselves some time to be prepared. Eventually, we're hopeful we'll get some better treatment options, etc.
Well, the country had contained in the previous 45 days or more this pandemic in confined areas and transmission, and was not in worry. Since there were few or no deaths at all that were registered, aren't we looking at massive deaths ahead, Doctor?
I hope not. I think time will tell. You know, as the Honorable Minister Acheng talked about in your clip from Masindi yesterday, this has bought us time to capacitate the regional referral hospitals to be able to better manage. I think one of the things that's been really unprecedented about this outbreak is the scientific collaboration. There are new studies coming out every day. Even in the absence of a vaccine or a highly effective treatment, we're learning a lot about the medical management of these patients. Oxygen, respiratory therapy, and other things that will really improve the survival. And remember, again, most people who get this disease will have mild infection. So our hope is also to protect those vulnerable individuals, older people, people with pre-existing conditions, to make sure that we keep the death rate as low as possible from this disease.
Well, is Uganda losing her achievements so far with the pandemic fight? Achievements like combating the COVID-19 within a short period of time, because we had a few number prior to the uprising truck drivers challenge that are now leading to community transmission, as you have seen. Are we losing our achievements?
No, I don't think Uganda is losing their achievements. Again, we have only 100 confirmed cases. I will say that we know that testing as many people as possible and testing the right risk groups is important. And so Uganda has done almost 50,000 tests. I think part of the reason we're seeing a few more cases in the last week is indeed we have identified those border points as risk areas. We have begun testing them, and some of the truck drivers, again, of the thousands of truck drivers who've been tested, only a few have tested positive, but we would never have known that if we haven't tested. And I think there are some countries, including some of our neighbors, where their capacity to test people is quite limited. A country like South Sudan, they have relatively few cases, but that doesn't reassure us because they may not actually be testing people at risk. I think Uganda has been doing a good job scaling up its testing capacity.
Looking at the region perspective, how is Uganda playing well, or are we playing well when you compare Uganda to the rest of the region in the fight against COVID-19? Because we're the last one to register, if I should remember well.
Correct. I think Uganda has done well. I know that they, at the government level, Ministry of Health, they are collaborating with their partners in other countries to discuss how to mitigate the issues at the border. When you look at the case counts, Uganda has the lowest number of cases, maybe except for South Sudan, which again hasn't really been testing a lot of cases. So. Again, I think Uganda acted quickly. They recognized where the risks were coming from at the airport, then at the borders, and I think the community transmission survey is giving even more information about where new hotspots of infections might crop up.
We've had issues where even if a sample is taken from, let me say, Kabong or Masindi, or where it is to be brought to the Uganda Research Virus Institute in Entebbe. What modalities do we need to have regional? We already have the hubs, but how potential they, how strong are they that we can do the samples and the testing, and we confirm from the regional before coming to Kampala, looking at the time lag there.
Indeed. So we're fortunate that there are a lot of good laboratories in Uganda, including Uganda Virus Research Institute. And we have a centralized testing model for things like HIV, where we use hubs in over 100 hospitals to collect samples, send them for testing, and return results. So we've been able to capitalize on that infrastructure. And to date, most of the testing has been done at Uganda Virus Research Institute. Makerere University has also started testing through the community survey. You heard the permanent secretary talk about mobile labs. Again, it's a very dynamic situation. So as new, what we would call more point-of-care tests become available, I think we are hopeful that these tests will be deployed closer to where the truck drivers are, closer to where people are. And indeed, there are expert machines that also will allow us to do testing at the point of service delivery.
Well, there's been an ongoing conversation about the search of the vaccine. President, in his latest address to the nation, he said it would take us like 18 months to get a vaccine. Where do we stand on the research of vaccine as Uganda or as CDC?
Sure. So as of last week, there were at least 6 vaccines in human clinical trials, and there's probably several dozen that are under investigation. The situation is very dynamic, and that's the good news. The bad news, though, is that it takes time. This is a new pathogen that wasn't known before 2020, although coronaviruses were known as a class of viruses. And it takes time to, number one, document, does this vaccine work? Is it effective? But also importantly, is it safe? And I think, yes, indeed, we do anticipate it would be at least a year, if not 18 months, before a vaccine might be available around the world.
Is from your assessment, Is Uganda ready to combat any other strain post-COVID-19?
Well, I think that a lot of the measures have been put in place. Again, this is unprecedented in its scope around the world. I think we're doing everything we can to keep the virus at bay, and as new technologies come available like vaccines, we would hopefully deploy them. I would share that, you know, Uganda has been combating Ebola since August of 2018. And when a vaccine became available, Uganda acted very quickly and was the first country outside of DRC where the epidemic was to vaccinate health workers in advance of having cases. So I'm hopeful that when a vaccine is made available, that Uganda would be able to act quickly for COVID-19.
Well, we have seen United States has already approved one from Gilead. What do you say about that?
So it's not a vaccine, but I will say that we are hopeful also on the therapeutics front. So Gilead has a treatment remdesivir, which is a broad-spectrum antiviral. There also are a number of other compounds that are under study right now, again, mostly for very sick patients in what we would call compassionate use settings where it's kind of their last option. But I do think because many different medicines to treat viruses have been developed, I'm also hopeful that we could begin using those so that if patients become sick, if they are high risk, they're older, they have pre-existing conditions, we might make their chances of survival better.
Wow. Well, there you have it. That is Dr. Lisa from the CDC here in Uganda. We're still having a conversation about the COVID-19 and what needs to be at the forefront. How do we protect? How ready is the nation? We'll take a break and we'll be back shortly.
You're watching Morning at NTV.
Morning at NTV, we are still having the conversation with the CDC director here in Uganda, Dr. Lisa. Dr. Lisa, earlier on, you had alluded to something to do with the vaccination. Let's talk about innovation and research. Is this a wake-up call for innovation and research to be respected and amplified in Uganda, and how best can we do this?
Certainly, and I think, as I mentioned, you know, one of the positive aspects of this outbreak, if there is one, is the tremendous scientific collaboration around the world. A new virus was identified, it was sequenced, that sequence was shared, labs around the world developed diagnostic tests and are continuing to improve on those diagnostic tests, treatments, vaccines, etc. Uganda actually is quite unique in having many different research collaborations. I think experience with the HIV virus, with malaria, with tuberculosis, with other infectious diseases like Ebola. There are many collaborations with our National Institute of Health in the United States, with other groups like the Medical Research Council in the UK, groups like Uganda Virus Research Institute, Makerere University. I know those collaborations already have begun for COVID-19, but I would anticipate that they will only expand. And indeed, our global environment is so interconnected at this point. It's really essential that we share information, that we work together on research to find treatments, vaccines, etc.
Well, let's look at Africa. Last week, there was a donation that was being made, if I should be exact, it was at the Danish embassy. And one doctor said that Africa was looking at its peak of these cases, that we're not yet at that kind of peak. What do you make of that statement?
I think that's possible. So indeed, the virus started in Asia in late December, early January. It came to Europe and the United States later. And I do believe outside of maybe North Africa and West Africa, it came to East and Southern Africa later. So I think it's quite possible that we will see more cases before we start to see the virus subside, unfortunately.
Let's talk about the partners you're working with. At such critical time, have they come in full force? Have they been a little bit resilient and strong enough to see that we have answers to the questions that lie?
Sure. So I think Uganda is also fortunate that we have an emergency operations center, and we have a national task force that includes all of the partners, development partners, scientific partners, humanitarian partners, et cetera. So even when COVID-19 was first coming on the horizon, we were already meeting regularly to discuss Ebola, to discuss yellow fever, to discuss other infectious disease and non-infectious disease threats. And those groups have continued to function. So I know the government of Uganda has been busy mapping out the resources that it will need to combat this. They've identified resources from within the government, but donors have also come together. So in the health sector, we've identified critical gaps in diagnostics, in therapeutics, in case management, and other things, personal protective equipment or PPE for health workers, but also looking at the economic impact, looking at food security. Donors have come together and have, I think they're building on good collaboration that was there to turn their attention towards COVID-19.
Well, there was a scenario where some Ugandans say that they would wish to be volunteers to help in the fight against COVID-19, especially the health team, in identifying and possibly reaching out to the ones who are positive from the village levels. Talking about volunteers, how best should we handle the issue of volunteers in such a strain in the country?
Sure. So I think the spirit of volunteerism is wonderful. I know many people have made small donations. Many businesses have approached the Ministry of Health and the government to see how they can assist. I know even at the borders, in some other parts of Uganda, volunteers are actively helping. So I think that's wonderful. I think as with anybody involved in the response, though, we want people to stay safe. We know that outside in people's interactions, President Museveni has recommended cloth masks for people who are out and about. And I think for volunteers or other workers who are engaged in actually dealing with COVID-19, it's just also important that people practice those same measures of precaution, hand washing, social distancing, if they're ill, staying home, etc.
Looking at another disease, that is HIV and AIDS, I understand CDC happens to do a lot of research around AIDS in Uganda. What do you make of the current situation, a nation dealing with two diseases, and now the AIDS patients are vulnerable, if I should say, and COVID is actually up and running? How best should we engage that kind of land?
Sure. So I think around the world, one of the things that happens when there's a new virus like COVID-19 and people are staying home is it becomes difficult to access normal health services, whether that's antenatal care, maternity care, malaria treatment. And I think we've certainly seen that here in Uganda and around the world. And so there is an effort to ensure continuity of services for people who may have other health conditions for which they need treatment. I think for HIV, we're lucky that Uganda has really done a lot to reduce new infections and to provide treatment for people who need it. We're getting close to HIV epidemic control, but like with other conditions, it's gotten difficult for people to get to clinics, to get their refills of drugs, to have their regular checkups if they're ill, to get services. And I think we are working with partners like UNAIDS, who you had on earlier this morning, to make sure that there is no interruption in services, and also that we are finding creative solutions. We're using community-based organizations to deliver medicines and to make sure that nobody misses out on their HIV treatment.
How do we handle the myths on the ground? There was a scenario in a neighboring country where the president said he's just going to do a lot of tests on hubs and all that can deal with COVID-19. And this kind of thinking at times in some villages in Uganda, possibly someone has that kind of mindset, thinking that local hubs, all the myths that run with the COVID-19 and HIV and AIDS could be in one way or the other used to heal the strain. How do we deal with such myths?
I think it's really important to make sure that we're sharing accurate information. CDC has a website, the World Health Organization has a website, the Ministry of Health actually has a wonderful website where they are posting all of the information they have in almost real time. I think Minister Acheng has been very active in talking to the community, even your president. I think the more we can share accurate information, but also be a little skeptical of what's out there on social media, what's out there in the community, do our fact checking and make sure that we're as much as possible sharing accurate information so that these myths don't circulate.
Absolutely. Well, going still about the same issue, a couple of things have been happening, but we want to really take your attention to something that is much, much more critical here. Talking about the volunteers, we have been seeing, we aired a story of a man recently that was in Entebbe who recently volunteered to spraying the hospital and also at the border points of Malaya and Busia. Is there a need for manpower, and on what cost?
Sure. I mean, I think as we've talked about, this virus is unprecedented. We've been fortunate in Uganda. We've had relatively few cases to date, but still 100 cases and a huge amount of effort to prepare for those cases and potentially more cases. So yes, I think volunteers are welcome. I know that the Ministry of Health has also looked to expand their workforce to address this, for testing of contacts, for collecting specimens, for providing risk communication messages in the community, for screening people at borders, and some of those are paid Ministry of Health staff or other staff that are supported through organizations, and some of those are also volunteers.
Well, let's look at the volunteers, and of course there was a spraying of the trucks at the border point in Busia. Let's take a look at this story and we get back.
Disinfection of trucks. We are going to spray target points where we think that our friends who are drivers of these trucks, the customs agents, have been touching, because those are the points that then can bring the virus. Now, the other thing is we are disinfecting the quarantine centers.
You see, in the quarantine, we are getting people from different areas who are coming in the country. And as they come in, we are supposed to disinfect the areas where they stay. And this is made to reduce other infections that may come with the big numbers, and also to reduce possible infections on the surfaces that would have come from people who are infected. This is supposed to be done also in our health facilities, but the team is going to move from here, and they will continue to the isolation units and other health facilities, include the port of entry.
Those are some of the volunteers in Busia and Malaya border. As you've seen, they're taking it upon themselves to spray the cars and to make sure that the quarantining areas are safe. Dr. Lisa, with the spread of COVID-19 in Uganda and breaking out in the nation, you had some works you're doing as CDC in Uganda. How have you stayed afloat that COVID-19 has not taken you off the ground and you leave the others hanging?
Sure.
And what are some of those programs?
Yes. So CDC, as a public health agency of the United States government, and there are other agencies here in Uganda like USAID and others, our programs are continuing. So we get funding from our Congress and from the American people largely to address HIV, tuberculosis, malaria, other emerging infections like Ebola, and those programs are continuing. I think we're fortunate that we've had a lot of support from our Congress in countries like Uganda through programs like PEPFAR. We have implementing partners who we fund, and those programs are continuing. Like the rest of Uganda and like the rest of the world, it's a bit difficult in this environment when movement is restricted, when we have different lockdown measures in place, but I think those programs are continuing. We're continuing to monitor the results of those programs, and I'm hopeful that as the lockdown begins to ease, we will go back to being able to ensure that those programs are achieving results.
Let's look at the region. A country like Congo, it's dealing with 3 outbreaks. Ebola is running, measles, and COVID-19 comes in play. With such kind of strains happening at the same time, they all rolled out the bowling. What could be the best approach, and how do you deal with such?
So I think Democratic Republic of Congo has a lot of challenges. I think, as we've talked about, and as is the case in Uganda, these structures, an emergency operations center, a national task force, good collaboration between government and non-governmental actors, including other donors and multilateral partners, is essential. But indeed, it's a challenge. I think they were on the cusp of declaring Ebola over in eastern Congo, and they got a few more cases. So I know even here in Uganda, we are working to ensure that the things we were doing a year ago to screen for Ebola at the border, we're continuing to do that. Now we're also screening for COVID-19. The screening's not that different, but I think those measures that we put in place for screening, for laboratory diagnosis, for workforce, to be honest, they help us with COVID-19, but they also help us with other diseases. And I think it's the same in countries like DRC that are combating multiple outbreaks at the same time.
As you're winding up, Dr. Lisa, let's look at the entire thing post-COVID-19. What is your picture like post-COVID-19? The people, the research, the new innovations and all that. What do you make of the post-COVID-19 situation?
That's a great question, and I think we're all in the thick of it. It's a little hard to imagine where we will be 6 months from now or a year from now. I do take comfort in the fact that there are a lot of highly trained Ugandans, people who have been doing research on HIV, on Ebola. Now they're going to help us do research on COVID-19 and also respond. And I think, as I said before, one of the unprecedented things about this virus has been the international collaboration, scientific, public health. I think that will continue, and perhaps what may come out of this, at least in a public health space, is even stronger collaboration across partners and across diseases. I think we've been worried about an influenza pandemic, and we've been worried about a respiratory virus like this since at least 2003 with SARS. Now we have it. I think we need to redouble our efforts to make sure that we can monitor this going forward. And I think we learned from the 1918 influenza pandemic that there wasn't, unfortunately, only one wave. There were several subsequent waves of people infected. So it's going to be really important that we continue those surveillance and mitigation efforts.
Well, Uganda had set a target to combat the HIV/AIDS by 2030. Now, how has this pandemic collided with this particular goal?
Well, as I said, I think our programs, and I certainly know that the government's programs, the AIDS control program, is still busy working. I think over the last month or two, they have had many meetings to develop guidance to ensure continuity of services. As I mentioned, community-based programs, where needed, facility-based services, that those things would continue. Uganda is on track to achieve its goals by 2020 and to end AIDS by 2030. I think that over the coming months, we'll have to take stock and see how much has this particular outbreak changed, course or had an impact. But I'm hopeful that we won't be too far off track.
Well, thank you so much. That is Dr. Lisa Nelson, Country Director from the CDC. It is an honor to have you this morning to throw more light about this and that, especially how we are holding up as a nation. Well, we'll take a break and I'll be back shortly. This is Morning at NTV.